Hello, I'm Dr. Naveen Somaya. I'm a specialist plastic surgeon in Sydney and the president of ASAPS. This workshop focuses on anatomy very specific for injectable treatments like botulinum toxin and injectable fillers, a very important part of facial rejuvenation. The detail of knowledge required to be a very proficient practitioner is of such a high standard that unless you do a very detailed and in-depth study of anatomy that pertains to your clinical practice, you will be unable to achieve the results that your patients expect.
A good understanding of facial anatomy is absolutely vital for all injectors. And the key with the ASAPS anatomy workshop is that it's injection anatomy that you're learning, which is different from surgical anatomy. What that does is it helps you get better results, and it also helps you avoid complications. So getting better results, you get more accurate placement of both your toxin and your fillers to get more natural results and better results, and you're also a better knowledge of anatomy, particularly vessel anatomy, is going to help you avoid complications.
The key to success in terms of safety and results in terms of injectable non-surgical treatments is knowing your anatomy. If you're not injecting the right product in the right plane and doing it safely, then A, you're running risks, and B, you're probably not going to get the results that you're after.
It is really important to know your anatomy well to be a safe injector, for several reasons. The first is that you want to avoid the blood vessels that can potentially embolize your filler injection to other parts of the face. The second is you have to understand facial anatomy to understand how aging occurs and how you can correct it. We go through all of these issues in our anatomy, dissection and cosmetic procedures workshop.
ASAPS runs this cadaver anatomy workshop once every year. We look forward to seeing you in 2020 and come and participate and learn your anatomy to translate into better patient outcomes.